Today I would like to talk about obsessive compulsive disorder. OCD is something that I've struggled with since I was young and I still struggle with today. I do have some notes here that I will be referencing during the video. OCD is a debilitating and chronic anxiety-related mental health condition. OCD is characterized by intrusive, disturbing thoughts, images, urges, sensations that cause distress. The distress felt by the person can be very intense. Compulsions are performed to relieve or reduce distress, but can only temporarily relieve the sufferer. This cycle of obsessions and compulsions become time-consuming and disrupt a person's life and daily functioning. Obsessions are the reoccurring disturbing thoughts, images, sensations, and urges that a person experiences. Obsessions can be about anything. Obsessions can be about topics that are taboo, scary, or violent. Some examples could be fear of becoming sick or making others sick, harming someone you love, fear of shouting inappropriate or harmful things, like shouting racial slurs or saying something offensive towards God. The most commonly discussed themes include, but not limited to, harm, contamination, sexual orientation, hyper-awareness and sensory motor, emotional and mental contamination, pedophilia, scrupulosity, religious and/or moral, hit and run, postpartum, and there are many themes, and if you don't see your theme listed, it doesn't mean you don't have OCD. Compulsions and OCD are behaviors or mental acts that someone does to alleviate distress felt by the obsessions. Compulsions can be the repetition of safety words spoken out loud or repeated in the mind, can be locking doors, washing hands, avoidance of people, places, or things, reassurance seeking, mental review, rumination, tapping, hiding sharp items, avoiding or getting rid of contaminated items, and excessive prayer. Hours can be spent in obsessions and compulsions and can cause disruption to a person's life and functioning. Treatments for OCD include ERP, exposure and response prevention, ACT, acceptance and commitment therapy, DBT, dialectical behavioral therapy, mindfulness skills, and medication may be needed as well. Discuss with your provider what is best for you. Therapists that specialize in OCD and ERP therapy can help you in treatment and be able to understand and help you in recovery. Many people with OCD have other co-occurring conditions that may require different approaches or treatments. A therapist will be able to help you with this. Some common comorbidities with OCD include eating disorders, depression, body-focused repetitive behaviors, autism and ADHD, generalized anxiety disorder, panic disorder, or bipolar disorder. I am not a professional, just a fellow sufferer. Please seek professional help. I will leave some resources about OCD as well as professionals and advocates down in the description. I've had many OCD themes over the years, and I will show some examples here just so you have an idea of what someone with OCD suffers with. This is only a couple and only what I am comfortable with sharing. I engage in body checking compulsions to see if I'm getting sick. I will repeat words over and over, either out loud or in my head. I pray repeatedly for either forgiveness or safety and well-being of others to neutralize intrusive thoughts. I can ruminate for hours trying to figure out a problem or to answer a question or to prevent something bad from happening. I become very uncomfortable with items that I consider contaminated, either physically or emotionally contaminated. I have gotten rid of items because of intrusive thoughts or memories I associate with that item, and if I still have an item, I am very uncomfortable around it or will avoid trying to look at it or use it. In this example with a stuffed animal, I do try to keep it on my bed as an exposure, so I do see it and I'm around it, but sometimes I still avoid it and avoid looking at it and I'm uncomfortable seeing it. If I see a red spot, even if it's just ketchup on the door handle of the fridge and I know that, I'll still think it's blood. I spent many years living with anxiety and knowing that something was off, but not knowing what it was. I spent hours and years in worries and intrusive thoughts and in guilt. I spent a long time not knowing what OCD was, and even when I learned, I still didn't know how OCD was growing and affecting me in so many ways. I am now in therapy doing ERP along with other approaches. I am in recovery, and it's not easy, but I hope to raise awareness with this video so people don't suffer for years not knowing. I encourage you to find help and a professional if you are struggling. Thank you for watching, and please check the description box below for any additional information and resources.